Hey folks, welcome to the Dr. Deals podcast, where we talk about healthcare business transactions. This is Nick Newsad from healthcontract.com. Today, I'm going to cover two things you should know about ophthalmology physician practice management fees. If you don't know anything about the ban on the corporate practice of medicine or physician practice management arrangements, go download my audiobook, Dr. Deals, from iTunes or Audible, and come back after listening to that. For everyone else who's already in the know, there are two things you need to know when setting management fees for ophthalmology practices. First, ophthalmology practice management fees need to be calibrated to your subspecialty mix. There are 4 major subspecialties of ophthalmology and 4 major subspecialties of optometry. Doctors are also fellowship trained in other areas such as neuro-ophthalmology. General ophthalmologists and ophthalmic plastic and reconstructive surgeons tend to have the highest practice expenses among physician subspecialties. That's because these two subspecialties tend to have the most in-office surgical equipment, surgical instrumentation, lights, stands, and supplies, as well as in-office laboratory and pathology equipment for examining tissue specimens and slides. Optometrist practice management fee rates tend to be similar to ophthalmologists. The scope of optometrist practice has expanded in over a dozen states during the past few years. We are now seeing many optometrists provide laser procedures and minor surgical procedures as well. The second thing you need to know about ophthalmology practice management fees is that calculating the fair market value fees for the professional practice is relatively easy. I have an overwhelming amount of data about the non-medical practice expenses of all types of ophthalmologists and optometrists. What makes it complex is the wide array of in-office ancillary services that may be billed out of the practice, as well as management fees for subsidiary ambulatory surgery centers. Ophthalmology practices can offer patients premium implantable intraocular lenses and refractive laser treatments, as well as outpatient cataract surgery in wholly owned ASC subsidiaries. Optometrists commonly self-refer patients for retail eyeglasses and contact lenses. The management company, or MSO, may provide special facilities, equipment, supplies, inventory, and support staff for a whole menu of ancillary services. When I am preparing a management fee analysis for an ophthalmology practice, I would expect to spend most of my time customizing management fees for the ancillary services. This is Nick Newsad from healthcontract.com. Give me a call if you need a fair market value opinion for ophthalmology physician practice management services. Let's do some doctor deals.